Let me start by first thanking the organizers of this conference. This is very important to us, especially coming from the Pacific, to come and share some of the unique challenges we face with respect to food and nutrition security or shocks. Like our chair for this session, when I first received the invitation from IFPRI to come and share some of the challenges we face with regards to foodborne diseases, I started Googling information on foodborne diseases in the Pacific. Unfortunately, it is very difficult to find quality data to prove, evidence of foodborne diseases in the Pacific. And this, I think, highlights one of our major challenges, data. Improving data collection in tracking or monitoring foodborne diseases. But let me just highlight a few points that or that shows some of the evidences of some problems with respect to foodborne diseases in the Pacific. Now, some of the work that our organization has been carrying out in the Pacific has already been finding that farming practices are a big concern, especially when the farmers are using a lot of chemicals. Like one of our officers was saying, he did a survey in 2 of the countries, and immediately when the farmers think about pest and disease, the only thing comes to mind is chemical. But if you further assess the capacity of these farmers, most of them are just, have low educational background. Some of them cannot even read the label of, safety label of chemicals. So this is quite a big concern. The other thing is water quality. Data that is available with respect to water quality is a bit up to date. We now know that only about 20% of the Pacific Islands or countries or communities are accessing quality water. And this is a big concern because now we're having a big problem with respect to diarrheal incidences or cases from medical centers. The other issue related to foodborne diseases is weak regulations on food safety and food standards. A lot of the countries in the Pacific Island area or region, they have very weak regulations in enforcing food safety and food standard. Not only they have weak regulations, but in terms of capacity, human capacity, it's very limited to enforce these regulations. Yeah, so it is really affecting or causing high vulnerability of the Pacific Islands to foodborne diseases. Now, what is known at the moment is that 80% of the household diets are from imported food, are contributed from imported food. Again, if you look at the weak, as I pointed out earlier, because of the weak regulation for the countries, this is a concern because we don't have even the capacity to test the quality of the food that is coming in. So I will just switch to what is, and talk about the nutritional problems we're facing at the moment. If you look at the WHO data, it shows that Pacific Islands have the highest rates of NCD or non-communicable diseases, including cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. And this is a major and a huge burden on the government and as well as individuals in the region. Now, we now know that 3 out of 4 deaths in the region is due to NCD. And what these statistics are telling us is that we're facing NCD crisis now in the Pacific. And if we don't take action on this, we're only looking at an escalated problems of NCD in the region. Now, I just want to provide an overview of the major causes of these NCD problems in the region. Now, as I said earlier, this is really mainly related to increased consumption of imported food. Household income and expenditure survey shows that about 80% of these food are directed toward these, expenditures are based on unhealthy food, such as fatty foods, high sugar and salt content food items. So these are really causing a lot of these cardiovascular and diabetic problems. About 40% of our youth are now obese. And with 40% obese, we're looking at further problems with NCD, especially with respect to diabetic problems. Okay, in terms of building resilience to foodborne disease and NCD problems in the region, we're looking at this problem as an integrated approach. We're assessing the problems, the capacity of the human capacity, financial, and all the livelihood assets we're trying to assess in order to really find out what are the problems related to these or causing these chronic diseases and in the Pacific. What we're finding is that the national data is quite up to date. A lot of the households that we've assessed, the food they're consuming is of very poor quality. So this is contributing to these NCD problems in the region. So I think what is really relevant to the Pacific Islands in terms of tackling or addressing these problems is really strengthening policy and regulations, strengthening research, and as well as strengthening human capacity to adapt to different circumstances. Chair, I will end there. Thanks.